Welcome, my name's Frank Donnelly and I'm the Program Coordinator for the courses at the University of Adelaide leading to registration as a nurse. And I'm going to talk for probably about 20-25 minutes and then I know that we've got a little bit gap between us and the next speech, so we might be able to get some questions in at that time. What's the difference? That's a good place to start. Why don't we get there? University of Adelaide has a significant, obviously, reputation and as the School of Nursing within the Faculty of Health Sciences within the university. Our goals are to uphold all of these attributes. We do have an emphasis not just on research and teaching, but particularly on making our graduates from the School of Nursing work ready. And that's certainly been the response to the program in the last 6 years that we've been running this offer. We do know that our students make a positive impact around not just their local community but more interstate and overseas as well, and we've certainly contributed students to those spheres of influence, I suppose. So that's the University of Adelaide, and I'm going to talk about two programs. The first one is the one that may apply to most people here, and that is the Bachelor of Nursing program, 3 years, typically the first experience, I suppose, that some people have of university study. And the second program, the Master of Clinical Nursing, is for people who've done a previous degree in something other than nursing. And if people are interested in that program, I'll wait behind after this and focus on that for those people if they like. Okay. In the years that I have done this talk, and I've put this slide up at the start, it really has come home to me that these things really do matter, and nursing matters. When you talk to people about the experience or their exposure to someone who has been ill and the fact that they've had a level of nursing care that's attended to that, you do make a difference when you're a nurse. This is part of an international Council of Nursing definition. And autonomous and collaborative is important because that talks about the fact that as a registered nurse, you take responsibility for your actions. You are, in a sense, responsible for the things that you do when you're looking after people. But obviously you don't do that in isolation. We work with medicine, we work with dentistry, we work with health sciences, we work with many groups of people towards the one aim. Advocacy, promotion of a safe environment and participation in health policy. That means that nurses also often take on a role of championing certain sections of society, and we do have a responsibility as nurses to try to ensure that distribution of health is as wide as we can make that go. So nurses very much more perhaps in the past are participating in these levels of policy, direction and decision, and the reason I'm focusing, I know there are nurses here in the audience today, and welcome everybody. But it's more about trying to emphasise that nursing as a career is certainly becoming more sophisticated, perhaps more involved in that wider policy direction around health, and possibly with more opportunities than there have been in the past. I'll talk about glamour and excitement in a minute, but I just wanted to underpin that with a suggestion that we as nurses have a privileged position in the healthcare system because we are the ones that are with people when they're the most vulnerable, when they're at their most ill. We've had students out on placement in rural and they've been there when a baby's been born, and they come back and they talk about that, and that obviously has been a life-changing moment for them because of this experience they've had. We also have students who have worked in hostels and in residential homes and hospitals where people have died. And the students see that not necessarily for the sad event that it might be, but more so for the, the privilege that it is to be there at that time. So you do make a real difference. Nurses make a difference in people's lives every day. We are respected, and I suppose as a consequence of that difference, generally you'll get a good hearing if you tell people you're a nurse. So it's a rewarding, dynamic and challenging career, and you might just underline the challenging at this time, because we'll see if that actually comes to the fore. So you do make a difference. I'll talk about the glamorous now. Okay, you can travel with nursing as a career, and certainly I get back stories of nurses who've come from this program, who've travelled overseas, and for some reason they think this will make me happy when they send me these photos of where they've been. It doesn't, but the opportunities are there. We have nurses that jump in the back of helicopters and go off and retrieve people from parts of the state, and they bring them back here. And those nurses, obviously you don't get there in the first few years of your career, but again, the foundation or the bedrock of the program here is all about clinical and all about getting our graduates to the point where they have the confidence necessarily to see themselves taking on these roles in the future. So yeah, if you want to one day fly in a helicopter, that's a possibility. The diversity of nursing careers as well is a thing that I just want to emphasise, because from working in a pretty isolated environment of the prison service through to perhaps being the resort nurse on an island, I have applied for that job, and I'm not sure if I've had any luck getting that. I haven't told my boss yet. She's right here. But you can do that. You can travel with nursing. And sometimes we get asked about, where does nursing take you in terms of the level of specialty? And it's fair to say that nurses, more so than ever, have opportunities to work at very high levels of clinical expertise. And so the role of the nurse practitioner is in Australia. There are quite a number of nurse practitioners now throughout Australia and South Australia. So again, the limitations on perhaps where you might want to go with your nursing career are really up to you. I'm not sure how well they've turned out, but again, whether it be in academia, research, or in a clinical profession, where do you want to go? Lots of options. Now, employment, I just want to put this up front, because I have to say that at the moment in South Australia, it's actually reasonably tight in terms of graduate opportunities for nurses. And nursing as a profession tends to have peaks and troughs in terms of employment. Having said that, this is not my writing. You can certainly Google this and look it up yourself, but there's projected to be a highly significant shortage of nurses in the next 5 to 6 years. And so this is probably not bad timing in terms of picking a career pathway. But certainly, as I said, at the moment in South Australia and around a number of states in Australia, it's actually fairly difficult to get a position in a graduate role. Okay, so what about the School of Nursing? How are we different? The School of Nursing has been around for just over 16 years, and for the 10 of those years was a focus on postgraduate, so the high-end sort of training for registered nurses, and people would come to the university for that specialist qualification, intensive care or emergency, etc. 6 years ago, an opportunity was taken to establish a Bachelor of Nursing and to sort of foster all the key skills and elements of the School of Nursing and the expertise that we had, and roll that out into a bachelor program. So very much our program that we have at this time is what we call person-centred. It's all about learning skills to provide care for a person. All right? And so as a skill, that's fine, and we can teach pretty much anyone to have that skill, but nurses need to have more than that. They need to have an understanding, a rationale, a desire, and an attribute to apply that skill to a person in need. This course very much has a focus on practice, and that sounds fantastic in one sense, but there is a trade-off, of course, and that is the level of commitment required to this course. We do work very closely with industry, and we have a number of learning hubs set up throughout Adelaide, whereby our students tend to go on a regular basis for their clinical placement experience. In terms of difference, our students are on placement at least 2 or 3 days of the week, every week. So there's a small, there's some holidays in there, but the emphasis is on that pattern of placement and theory being delivered consistently. And we need to be really conscious that we are preparing people to work in a system that allows you to adapt, because that's what healthcare is doing at the moment, is trying to adapt to any number of challenges. We do emphasise team working skills, and we do that a few ways within the program. And I'll try and emphasise some more of the key features as we go. A large part of our success has been people we call clinical tutors. And they're registered nurses, well, they're all registered nurses, but generally they've had a recent clinical experience in, if you like, real hospitals. They come across and they work for the University of Adelaide and they provide bedside teaching. They manage a small cohort of students and their job is to make sure that they, from first year through to third year, you have the same tutor all the way through and they follow your progress, that the end product, if you like, as a graduate, is a reflection of that consistent relationship provided by the clinical tutors. And their jobs, they go amongst the learning hubs and they identify opportunities for students to learn things. So they are an integral part of our success. Entry criteria. Okay, at the moment, there is no oral assessment to get into the Bachelor of Nursing. We used to have one for the University of Adelaide, we don't anymore. All right, so at this point, it's ATAR based. What that means, if we get 1,000 people with an ATAR of 99 applying, then our ATAR will be 99. All right. Last year, our ATAR for our quota went down to around 74. So that's sort of the mark that you would be looking at to, hopefully win a position in the program. And just on that, I'll talk about that in a minute, about the actual admissions pathway. So we offer opportunities for people of mature age or the STAT test. We have graduate entry, so if you've got a previous degree in something else and you're thinking about nursing as a career, the Master of Clinical Nursing is brilliant for that. And we also have old nurses as well. And we have had Indigenous students graduate from the program and go off and work in nursing as registered nurses. University uses a couple of terms, and one is the prerequisite, and one is assumed knowledge. We assume that applicants have a knowledge of biology. We haven't mandated that it's an actual particular prerequisite for the program just yet. So very much, if you have an opportunity to do biology across year 11, 12, we strongly recommend that you do that. English and maths, also very good, because as a nurse, you can't get away from doing drug calculations, and sometimes that scares people and they run out the room. It's okay, we'll teach you how to do that as well. We're the smallest program in South Australia for pre-entry nursing. We only take 150 students, and that's good because the focus is on you, and that's bad because that means you can't hide. We know who you are, and we won't lose you. Because we are a small program, this is really important. If you want a position at the University of Adelaide for the last 2-3 years, we have not quite got to our final quota number because we only release a certain number of places in line with the SATAC offer rounds. And what that means is we can't offer 400 offers in the first round because we only have 150 spots. And that means is that we don't have another 250 clinical placements available. Does that make sense? So if you do, you desperately want to come to the University of Adelaide, that's fantastic. Make sure you put AB on your SATAC response form, and that'll allow you to be considered for us if we then make you an offer in the second or third round. And I can't overemphasise that enough, because we have had people come back quite disappointed they missed out. In fact, they wouldn't have missed out because we had 1 or 2 spots left for them. So there you go, that's That's the week. So the week is first year, lectures, tutorials across Monday, Tuesday, Wednesday. Thursday, Friday is placement. And placement starts in week 8 of first semester, first year. Let that one sink in, because that means you're out there doing nursing work quite early in the program. And so you can imagine our highest attrition rate from the program is at the end of semester 1, first year. All right? And that's good, that's okay, because people have had an opportunity to look at what nursing is in a residential setting or a hospital or those sorts of environments. So we're not tying up people for 2 or 3 years before they have an opportunity to experience what nursing is. We flip that around in second and third year, and the emphasis is on 3 days a week of clinical placement, 2 days a week of university. And those university days are pretty full, as you can imagine. Pretty much 9 to 5, lectures, tutorials and workshops, etc. So it is a very demanding program, and that timetable hopefully reflects that. We get asked this a lot. Before you actually can go out on placement, and again this needs to happen before week 8, you have to be immunised, you have to have a TB screening, you have to have a criminal history check, registration with the national registration body happens, but you don't have to pay for that in any way. It's just a consequence of enrolling into a bachelor program for nursing. And we want to emphasise that, because if you don't have those things, for whatever reason, you can't go on placement. If you can't go on placement, you can't satisfy the requirements of the program. All right, so that's up there. And we obviously give much more detail about that at orientation and etc. Okay, where do our students go? For placement, they go pretty much the full range of specialties. Our students go to aged care, mental health, paediatrics, theatre, critical care environments, community environments, rural is compulsory placement in second year, and that generally throws people at the start when they're thinking about doing this program, but as a rule, the vast majority of students, when they return from their rural placement, have had a fantastic time and really great experience. Placements occur across the whole year, and what that means is that, for example, next year our third years are going out on their specialty placements in January. So we don't fit into the traditional university calendar as such, and that's deliberately so that we can expose students to all of these different environments for nursing. We have a range of, as I said, learning hubs and arrangements with some of the largest providers of healthcare services in Adelaide, and they're wonderful partners with us, and it really does make a difference if you are allocated a learning hub that allows you some consistency around your development over that 3 years. So at the end of your time, it's a good wage. Mind you, that's working a 7-day rotating roster. So that's your weekends, your night duties, your Christmas Eves, your New Year's Eves, and whatever. But as a full-time wage, that's fairly good, I would have thought. There are many opportunities in terms of diversity, and we do have graduates go to work in aged care, acute care settings, mental health, and even general practice. There's lots of specialisation available for nursing, which is a good thing. And touch wood, so far, we, in our program at least, have 100% satisfaction rate. And I think, again, that reflects the pillars of what we are, which is a focus on you as a student, in small cohort size, lots of clinical placement, early placement exposure, and we go from there. In terms of pathways, you can, if you want to, you can stay in a clinical stream for all of your nursing career, and if you like, the pinnacle of that is as a nurse practitioner, and you have a much wider scope of practice than as a registered nurse. If you want to, for some reason, go into management, you can, and consequently academia is also an opportunity for people to go through. And nurses, in terms of pathways, can go through from your bachelor. Many people graduate and they're quite happy with a bachelor. Specialist graduate diplomas, intensive care, emergency, whatever, paediatric nursing, through to a PhD if you want to at some point in your career. So that's probably not your main focus just yet. As I said, and we're not trying to sugarcoat this in any way, this is a demanding program. All right? You're looking at 35 to 40 hours per week. The academic year is extended and there'll be earlier and possibly later start times. And in that sense, if you're working to pay off a large mortgage, this may not be the best program for you, but if you have opportunities for that, and don't get me wrong, people certainly do work part-time as they're going through the program. They absolutely do. They need to think about how they articulate that around the course requirements. Trade-off is, as I said, we have an excellent response to our graduates from the local industry, healthcare industry. They are in demand in a very tight labour market at the moment for graduate nurses. So there is a trade-off, no question. Must say the curriculum's changing in 2014, and please don't panic. We're keeping the best things, I hope. Well, no. The best parts of the program, things that are changing are some internals. We're changing some course unit values, but the fundamentals won't change. We'll stay a small program. Clinical tutors to support practice, all of those things will be there in 2014 and beyond. That's just to prove that people actually do finish the course and graduate, despite all my dire predictions. And as I said, for us, it's the wonderful part about it is we get to know our students as people, and as I said, not just a number. Yeah. Right, and that's Tara, who I used to work with in intensive care, and wonderful nurse. I'm not sure if she knows I'm still using that photo, so please don't tell her. Right. I'm happy to take some questions. Sometimes questions come up and they're general ones. If you've got some specific, nitty-gritty questions, I'm more than happy to answer those either outside perhaps or over at the hall or down at the marquee. Anybody? Grab me personally. You can't all grab me personally because it's not that much of me. Hi. Yeah. Sure. Biology leading into the course is an advantage, don't get me wrong, but we certainly have students who have not done biology and they manage. It's hard work, absolutely, but they get through. Yeah.
Is there any sort of course, but a program where you can sort of catch up on it?
Yeah, the University of Melbourne offers a preparatory program for anatomy and physiology that a lot of people that we've referred to have found that's been okay. It's correspondence. I'm not sure, it used to be around $200 or $300, and that has, people have found that quite useful leading into the program. Yeah. Yeah. Now we don't have an internal catch-up course for that, if you like. We don't offer summer classes for. I'm sorry. I don't know. Honestly, I don't know. I'm sorry.
Is midwifery part of the specialist, or is that something completely different afterwards?
No, midwifery is something different. So within a general registered nursing program, which is what we're doing, there are no opportunities particularly for midwifery. And whenever I talk about midwifery to people, I always suggest that people do a general nursing program first and then do a midwifery qualification after that. If you do it the other way around, you may not get as much credit towards your general nursing course if you did your midwifery up front. Sorry, there was a question over. No, that's our combined title. We have a small quota for international students, but the bulk of that number is for domestic onshore South Australian applications, yes. Hello, sorry. Question is there any advantage to a combined degree? And I don't know that people, well, one, we don't offer a combined degree at this point with the Bachelor of Nursing. And as you saw from perhaps that slide, your time's pretty much full with placement, which is giving out those skills and knowledge about hands-on practice, yeah. Mm-hmm. Yep. In terms of placement, where can you go? We have a number of learning hubs where we send students to. So the Royal Adelaide Hospital is a learning hub, and students tend to go there for the majority of their 3-year experience. What will happen is that, of course, there's no paediatrics at the Royal Adelaide, so students come out and they would attend the Women's and Children's Hospital for that experience and then come back to the Royal Adelaide. But there's also opportunities to move out for community, mental health, etc.
Apart from the clinical experience that goes every week you study,
Mm-hmm.
you talk about placement.
Yes.
Can you,
Same thing.
Can you tell me what years and what length those placements are? Are they?
Yeah. So placement is clinical. When I talk about clinical placement, that is your experience. And they start in week 8 of first year, and that's every 2 days for the rest of the year, other than mid-semester break. And then in second year, start again and go all the way through to the end of third year, which is 3 days a week. So that essentially, from week 8, every week that the program is being run, there is placement on offer or placement expected of students when they're out.